Okay. Hi, everybody. Good afternoon. How's everybody doing today? I hope well. Good, good. So my name is Kimba Gosier. I'm president of Advancing Sickle Cell Advocacy Project. We're a nonprofit organization located in South Florida. I just want to say thank you to Dr. Bailey and the SC3 team for putting on the 12th Annual Warriors Convention. This whole event has been nothing short of amazing, and I'm proud to be a partner of the consortium since its inception. So with that being said, I'm just going to talk a little bit about my organization very briefly, and then I'm going to talk about the topic at hand, which is our virtual chronic pain self-management program. So we go by ASAP, which stands for Advancing Sickle Cell Advocacy Project, but it also stands for as soon as possible. Always say a prayer, as our community outreach coordinator Stephanie likes to say. We're a nonprofit 501c3 based organization established in 2015, and we provide support services for individuals and families impacted by sickle cell disease in South Florida, mainly Dade and Broward. We provide a host of activities to engage the community and address psychosocial needs of the sickle cell warriors. We have an annual sickle cell picnic and family resource fair that we do every year. We also have a program called COPE, Community of Parents Empowered, which is an 8-week program engaging sickle cell warriors under 18 and their parents, where we teach them coping strategies on how to live with sickle cell disease. We engage in art therapy, music, mindfulness. We just added gardening to the 8-week sessions. And we also have an annual faith brunch for sickle cell that we do in January to start the year off right with prayer and hope and thanksgiving for the year. We also have a collaborative education project that we do with medical and nursing schools, also hospital systems. We work with the University of Miami, also Memorial Healthcare System as well. We have panel discussions that we've been doing since 2018 with Nova Southeastern University as well as FIU. We have a partnership every year. We have sickle cell workshops with our future doctors and nurses. We find these to be extremely engaging and important to engage with our future doctors on the ground floor before they become healthcare providers, so they can see and talk to sickle cell warriors firsthand outside of a hospital setting when they're in distress. And again, like I said, we've been doing that since 2018. Very proud to say that last year we started a scholarship fund for sickle cell warriors in the name of Kevin J. Francis, who was someone like a little brother to me. So last year we awarded 7 scholarships to sickle cell warriors. This past June, we were able to award 5 scholarships, and this time we had 2 mothers that have children with sickle cell disease that were awarded scholarships. So we're very proud to be able to do that. So that brings me to the point of what I'm here to talk about today, which is the virtual chronic self-management program. We all know that sickle cell disease, pain is the hallmark of the disease. That's what everyone knows most when someone complains about having sickle cell disease, is the excruciating pain that it causes. So one of the ways that we wanted to help with that issue is this virtual chronic pain self-management program. And in the spring of 2023, we launched the program through a grant through United Way of Miami. It was a capacity building grant that we were able to obtain, and it helped us to launch the program. Yeah. Oh, okay. Sorry, I was told the mic was blocking, so thank you. Oh, the computer. Oh, yes, okay. Yes, okay. Is this good? Can you see now, or is this okay? You still can't? Okay, yes, okay. All right, thank you. So, like I was saying, we received United Way Miami funding to launch our program in the spring of 2023. And according to the NIH, about 50% of people with sickle cell experience chronic pain, and it has a negative impact on their quality of life. So one of our goals is to offer preventative care. And this chronic pain self-management program, we consider it preventative care. When you're admitted to the hospital, normally a lot of times the social worker will come talk to you. They offer services to you while you're inpatient. But then when you go home, it's like you're basically kind of on your own. There's not a whole lot of services being offered. So that's how we started with the chronic pain program. And it's about improving the quality of life, learning how to live with your pain. We're not saying this program will, if you take this course, this workshop, that everything will be perfect, you'll never have pain. That's not what we're saying. The workshops is to teach you coping strategies on how to still have a quality of life and deal with the chronic pain. So we focus on helping people do things that are important to them, to still keep doing things that are important to them despite having the pain. So the program is actually was developed by Stanford University. And it was developed by Stanford University, and it features peer leaders. So it's not a new program because Stanford University is the ones who developed it, but we took the program and we offer it strictly to individuals impacted by sickle cell disease. Not only that, the people who lead the workshops are sickle cell warriors or either a caregiver of someone with sickle cell disease. So they have an idea of what it's like living with sickle cell. So the workshops, when you think of a workshop or a program, a lot of people, you're like, oh, I don't want to go to school, I don't want to take a class, but it's very fun and it's interactive. And it's only 6 weeks. And it's to help reclaim areas of your life that's impacted by pain. It's designed to increase self-efficacy and achievement of self-management goals, healthy behaviors, coping strategies, symptom management, being active, practicing relaxation techniques. So it focuses so much more on just pain. You will receive different distraction techniques. It helps with fatigue and mood, and fatigue is a very big problem that impacts sickle cell warriors. So about the program itself, like I said before, it's 6 weeks, once a week, lasting 2.5 hours every week. So when someone signs up that they're interested in this program, there's 6 things that they're going to receive, 5 things that they're going to receive. The first thing is access to an online coaching app. And they keep the access to this app even after they complete the program. They also receive a copy of Living a Healthy Life with Chronic Pain book, which they can refer to at any time. It has different activities and worksheets, which they go over in the program, and they can always refer to. They also receive the Moving Easy MP3 or CD. And what that is a program that shows you different breathing, different movements you can do, different exercises you can do for people that are impacted by pain. Some of the exercises you can do sitting down, but it's very important to keep moving even though you're having pain, different things you can do to keep your blood circulating. They also receive a relaxation mind and body MP3. And at the end of the 6 weeks, they receive a gift card incentive for completing the program. So the program is 100% free. The only thing you need to have in order to qualify is to be diagnosed with sickle cell disease, be at least 16 years of age, and live in Florida. However, the grant that we got previously required you to be in Florida. However, we're opening that up now outside of Florida. Thank you. So you just have to have access to either a computer or a phone with a camera. You don't need nothing fancy. You can do this workshop from your phone. And we ask that you do pre and post program surveys because we want to evaluate if it's efficient, and we want the program to help, to be making an impact. So we ask everyone to do pre and post-program surveys, and that also helps with the grant funding. So in terms of the actual workshops itself, it's very highly participatory, it's very engaging. Participants share, and each participant is guided to tailor the workshop content to their own needs. So it may be a topic that's covered that one warrior, it might not resonate with one warrior, but another subject might resonate with another one. So we encourage to take what you benefit from and apply it to your life. So again, the Self-Management Resource Center, we were able to obtain the license to teach the program, and it's in small groups. When they did the research, they found that the smaller the group, the more intimate, the more impactful, the more you would gain out of it. So they do have a limitation on how many people are in the workshops. And you can offer this program in person as well. However, we chose to do it virtually. So for the virtual format, it's 8 to 12 participants. And we just recently, last month, had our third cohort. We had 3 cohorts from April, May, and June, and we finished the last one on June 19th. And like I stated, the leaders either have sickle cell disease or they're a caregiver of someone with sickle cell disease. They're not clinicians or health professionals, but like I said, they either have sickle cell or have a child with sickle cell, and they are trained and certified to lead the workshops. They take their own training. So just a lot of questions that sometimes people may have about the program itself. It doesn't conflict with any existing program or any treatment that someone may be under. Anytime someone may have a question about their care, we refer them back to their physician, because again, we're not clinicians. We're there to lead the workshops with the coping strategies and mechanisms. So if someone has a concern, whether it be mental health or their physical health, we refer them back to their healthcare provider or medical professional for those type of questions. And like I said, it was developed by Stanford University. So they created this program based on information they got from focus groups with participants and national standards for such things as exercise, nutrition. They consulted with pain experts as well to receive this information, psychologists and physicians. So they all combined their input with these processes to increase the self-efficacy and to allow participants to self-tailor the workshops to their own needs. So many methods of cognitive behavior therapy are included in this, not just, coping with pain. So we were able to successfully train 12 staff and community members, and when I say community members, I mean sickle cell warriors and caregivers in this chronic pain self-management program. Due to grant funding that we did receive this last term with the Foundation for Sickle Cell Disease Research. And so, like I said previously, we were able to successfully purchase the license from the Self-Management Resource Center. And we were also able to get a monthly subscription from a HIPAA-compliant telehealth software, which we use for this program. And with the pre-surveys, everyone's information is secured through this software. And we collect and we store and evaluate the data from the participants, and is housed in this app that we use. So like I said before, participants, they're able to download this app onto their phone. This is how they sign into the workshops every week. It sends them reminders about the workshops. Is how their leaders communicate to them different things they may want to talk about prior to the upcoming next session. So they're able to keep that. Everyone that has gone through the workshop, they still have this app on their phone that they can refer to. And so in terms of like quality assurance with the program, that consisted of myself, a program coordinator, virtual assistant, and the peer leaders who are, like I said, caregivers or sickle cell warriors themselves. So again, the topics is not just about pain. So you have a whole there's so many different areas that this workshop in 6 weeks covers. Just to go over a few, balancing activity with rest, tools for overcoming worst case thinking, negative emotions. There's even a part in the workshop about healthy eating, how to read your food labels, learning things that can trigger you into a sickle cell crisis or can contribute to your chronic pain becoming worse. Journaling and action planning. You can read all the bullet points. I'm just focusing on a few. The last one, the journaling, action planning, problem solving, and decision making. When we do the post surveys, the action planning ranks at the top because it holds people accountable for things they want to accomplish, and it gives them an incentive to want to continue. They have a goal set. That's basically what the action planning is, goal setting, and setting realistic goals that you can achieve. So that ranks very high. That and the Moving Easy program ranks very high amongst the participants at the end of the workshop. So how do we evaluate the effectiveness of this program? We use a sickle cell self-efficacy scale, and it's used in the app that I just mentioned that we have. And also the pain, enjoyment, and general activity scale. They take this survey prior to the workshop, so we have a baseline idea of where they are in their journey with coping with having sickle cell, coping with having pain, coping with fatigue, and all these things. And so at the end of the 6 weeks, they do a post survey so we can measure the success and how their self-efficacy increased over that time. So the percentage of time participants reported meeting their self-management goals. So for our last workshops, like I said, we had 3 cohorts, and based on the data that we received of the 44 participants who completed at least 4 or more sessions of the program, the intervention was very effective in improving self-efficacy and helping participants learn how to set and meet their goals. So the program was able to significantly increase the participants' self-efficacy goals by 70% of the time, which was a big improvement compared to their baseline when they started. So they were able to almost reach 100% of meeting their goals. One of the questions on the survey, the post survey, was what was your goal before you started the coaching? This is just a testimonial from one of our participants. Their goal at the beginning was to find different ways to counteract the old ways of handling pain with new aspects of relief. They said, I know that this coaching is truly beneficial to warriors like me because of the knowledge and support that derives from these sessions. Were you able to complete that goal? The answer was yes, and then some. So in conclusion, the techniques learned can help change how you think and in turn how you feel and behave about pain. This is a valuable strategy for learning to self-manage chronic pain. These are 2 individuals that took our workshop and are now leaders. I have a very short video that's less than 2 minutes that I want to share with you guys. Just gives you just a little quick overview about the program, and that QR code you can actually scan to register because we're taking participants onto a waiting list right now, pending future funding for the next cohort. So if you're interested in this program, you can sign up now and we can take your information. Do I hit just play the video? Okay. Is that allowing you to play it? Okay, that's fine. It's on YouTube. If you want to go to Advancing Sickle Cell Advocacy Project's YouTube channel, this video is on there. But again, that's the QR code if anybody is interested. Like I said, we're currently accepting applicants on our wait list, and that's the website also where you can email us for more information. And also, if you wanted more information, you can follow us on our social media platforms at ASAP Be Informed. And I have members of ASAP here in the audience. Some of them have taken the course as a participant, and some of them are also trained to be leaders. So if they don't mind standing just to say hi real quick, and I'll bring Jessica, if you want to say, you were in the one that just ended, correct? The last cohort? If you would like to share as a caregiver, the impact.
Hi, everybody. I was trying to stay away from the stage, but got pointed onto the stage. My name is Jessica. I am a mother of a 11-year-old warrior. And personally, I found this class to be very beneficial because it talked about many strategies for managing pain. It helped with not just my warrior, but with myself because personally I deal with chronic pain. So there were many breathing techniques that were discussed and distraction methods and just different things that you can enlist to add to your toolbox of managing chronic pain, which was very beneficial. As was mentioned in the slideshow, actually, action planning, I thought was one of the best things in the class because a lot of times we have to-do lists and a million things we want to accomplish, and then we don't feel accomplished because you don't get to complete those lists. However, with the action planning, it broke it down so that you could focus on, one or two specific goals that you can envision accomplishing in the week. And then when you set those goals, you're very specific with setting those goals on the days you'll work on it, the how many days, or the amount of time. But you break all of that down so then it makes it very attainable for you to accomplish. And it just helps overall with being able to manage self-care and your care of the warriors.
Thank you, Jessica. And Maya, as a sickle cell warrior, if you can just share. Thank you.
Thank you. Good afternoon, everybody. My name is Maya Thomas. I'm a sickle cell warrior. I'm from Miami, Florida, and I am an advocate for sickle cell disease through ASAP. And we've done so many various things throughout the years I've met Kimba, which was actually at a Warriors conference in Atlanta. So the chronic pain program I've facilitated. I took the training, which was 2 weeks, and then oh, sorry? Oh, I'm sorry, I said two. 7 weeks, but it was twice a week. That's where I got the two from. Okay, so it's twice a week for 7 weeks, and I've done 4 of them facilitating with the co-leader. It teaches the patient or the caregiver, whoever is in participation, how to deal with and manage their care, how to eat better, what's the difference between a portion and a serving size. It also indicates to you different like Jessica said, breathing techniques, management, how to discuss your issues with your doctor or your primary care physician, whoever that may be, whether it's hematology or anybody that's providing you service. And the majority of the things that Kimba indicated regarding the Moving Easy program, which is almost like chair aerobics, and the mindfulness where it tells you how to distract yourself. It also provides you with information regarding Say, for example, if you have a friend and you're not feeling well and they want to hang out with you, and you have a plan to go somewhere, and you're like, not today, but you still want to hang out. It gives you a way to say, I'm not feeling good today. I still want to go and engage and do something, but can you just bring me food and we can hang out together if you're not having a good day? It tells you how to engage with people and as well as yourself. So I encourage everybody to sign up since it's open throughout the country now versus just Florida. And it gives you a set of skills, just like the action planning, as Jessica said. You set your goal from 0 to 10. You want at least a 7 because it means you're going to do it. So say, for example, I like to go to the beach and I like to walk. My action plan would be, I feel confident enough throughout the week, I'm gonna go twice a week, and I'm going to go on Tuesday and Friday for 2 hours, and I'm going to walk. How confident am I about going to do this twice a week? I'm an 8. Okay, so that would be my goal and set my action plan for the day. And when we reconvene for the next session, we ask everybody, did you meet your action plan? If not, because you were in pain, that's perfectly fine. But at least you had it out there so that you can kind of be aware of what you're doing with yourself. You know, am I taking my medicine? Am I drinking my water? Am I accomplishing my goals? So these give you skill sets to put in your toolbox regarding managing not just your chronic pain, but how you engage in life as a person with chronic pain.
Thank you, Maya. So that's it, unless anyone has any questions. I appreciate each and every one of you for being in here and listening to the presentation. Thank you so much.